Did you know that as little as 10% weight loss can restore regular menstrual cycles and lead to improved fertility in women who have weight management issues? Hi, I'm Dr. Andrea Dunaif, and I'm the System Chief for Endocrinology, Diabetes, and Bone Disease at the Icahn School of Medicine and the Mount Sinai Health System. I treat a lot of women with PCOS, and one of their major concerns is getting pregnant. This is in the news because of our new weight loss drugs, semaglutide, which is branded as Ozempic or Wegovy, and many women taking these medications are now finding themselves pregnant. Drugs like Ozempic are excellent for achieving weight loss, which can not only restore fertility, but substantially reduces poor outcomes during pregnancy. However, we don't have a lot of information about the long-term effects of these drugs or the effects of these drugs. Therefore, it's very important to work with your physician while you're taking these drugs and discuss the possibilities of becoming pregnant.